hello, Maya Gray. Welcome to the Doing CX Right show.
Thank you so much, Stacy. I'm super excited to be here and can't wait to get it started.
Oh, we're going to go right into getting it started because I know that people are going to love this episode and soon they'll know why. But before we go really deep, I wanted to have you share, who are you, Maya? What do you do professionally?
Sure. So I've worked in healthcare for the past 20 years at the intersection of business and technology, but always representing the customer or engaging with the customer or advocating for the customer. So I've been customer facing pretty much my entire career. Currently, I'm the vice president of the Global Customer Experience and Engagement team at Pfizer, where we leverage research and strategy and design and measurement to really partner with internal stakeholders to design experiences for our customers.
Oh, that's a lot. And you know a thing or two about CX and patient experience in the whole industry. So we'll get to that. But before we do, one fun fact for people to know you. What's something that maybe people don't know about you?
So interestingly, the year I was born, on my father's birthday, he opened an art gallery, African art gallery, that he named after me, the Maya Gallery. So it was a huge part of my life until my 20s when he closed it. So a lot of folks don't know that.
Yeah, I do like that. We could spend the whole episode on that experience.
we really could, Stacy.
We really could. Well, I'd like to ask my favorite question of every episode, and that is, looking back in time and your youth, what would you tell the younger Maya, 20-year-old self, if you could go back in time right now?
Yeah, I have so many things I would tell Maya. One is invest more aggressively and deliberately. I could probably not be working right now, given where I was in my 20s. Yeah. And explore even more. I've always been good about traveling, but I just think that, once I really got started in my career, I didn't do as much exploration as I could have. And I haven't lived abroad, and I wish I had.
Well, we are all still learning and doing and experiencing. So I think we might be able to say it's not too late.
Yes, agreed.
Well, speaking of experiences, when I say doing customer experience right, what does that mean to you?
So let me just start by how we define customer experience. And that's as the sum of all interactions that a customer has with your organization. And for me, most importantly, how a customer feels about those interactions. So to me, doing customer experience right means ensuring that in an ideal world, the customer is happy or feels good about all of their interactions with your organization. Now, obviously, that's not realistic. No one is on top of their game at all times. So I would say doing customer experience right is about making a customer feel good most of the time and at all of the touch points you can with your organization. I personally feel like companies get CX right when they infuse a little bit of joy, some bite-sized moments of joy in their customers' lives. So that's it.
Well, you talked about touch points. What does that mean in your industry?
Sure. So for Pfizer, it's both kind of digital or virtual touch points as well as in-person touch points. And it goes across the organization. So we have what we call customer-facing colleagues, and those are subject matter experts in our medical affairs organizations or sales colleagues in our commercial organization or account managers. They actually touch the customers. We also have patient advocacy within our organization, so they touch the customers. But Pfizer has, I don't know how many thousands of virtual sites, of digital sites that customers, that those could be healthcare providers, they could be patients, they could be advocacy groups, they could be caregivers, investors. There are so many different ways that a customer can touch us. So really it's about what that experience looks, regardless of the touch point or who they're engaging with directly at Pfizer, and how we are able to deliver on that experience consistently, which is pretty tough given the size of our organization, right? Everyone kind of does things differently. And we're working on that consistency of approach and presence for customers.
I've worked in many different industries, and consistency is a challenge, especially the bigger the organization. Besides that, what do you see outside of your workplace, but in general? What do you see as the biggest challenge in creating that next generation of integrated experiences for patients and healthcare providers and partners? Maybe you want to break that down a little.
Yeah, and I think this may sound basic, but to me, the biggest challenge is ensuring that we keep patients at the center of everything we do. And I say that because we need to deeply understand the motivations and needs of patients to design these integrated experiences. So whether they're in person or virtual or through a business partner of ours, but we really need to understand the patients to meet those needs. And we can't, any of us, whether it's Pfizer or one of our business partners, focus just on our business needs. So in healthcare, I do believe that ultimately everyone is in service of the patient, either directly or indirectly. So we do need to make sure the patient is successful.
So when you say that, my head goes to there's a lot of challenges, a lot of opportunities in healthcare. What do you see as the challenges in the current year, in the current state of where we are, especially with technology accelerating so fast? What do you see as the big industry challenges?
So to me, from a patient's point of view, again, I want to wear my patient hat versus my Pfizer hat, is access.
Mm-hmm.
And that's access to services, access to information, access to medication. And in order for us to provide like these integrated experiences that really deliver on what a patient needs, we have to help address access issues.
So when you say that that's a challenge, where has it been and where do you see it is today in improving access?
Where has it been? So I guess one thing is that I think Deloitte did a study a couple of years ago and estimated that access issues cost the U.S. healthcare system, I think it was over $300 billion. And that was 2 years ago. So the number is only growing. And they anticipated, I think, by 2040 that number would be $1 trillion. So it's huge for us to address these access issues. And when you look at communities that are disproportionately impacted by access issues, it's usually the lower income communities and or rural communities. And I'm focusing on the US because when you get broader global, I'm not an expert, but it's a bigger problem. So one thing is cost of care. So patients are uninsured or underinsured, or even if they're insured enough, they may not have enough money to pay out-of-pocket expenses. And this happens for both lower income as well as higher income individuals. Also, availability of care. I don't think I need to tell anyone that we are at a shortage of healthcare providers, and that's across the spectrum. So doctors, nurses, PAs, et cetera. I think that there's some stat where I think by maybe 10 years out that there will be a shortage of, I think, 124,000 providers in the US. And a third of that deficit would be primary care. So we not only do patients not have the insurance coverage they need, but they may not have access to providers as well. And then, depending on where someone lives, there could be transportation barriers. And I think that's one of the biggest social determinants of health, or one of the bigger, I should say, social determinants of healthcare at this point, where those who live in rural environments may not have the transportation access that they need to see providers. And I can also say, there's sometimes healthcare deserts, whether you're in rural areas or in urban areas. I lived in Washington, D.C. for the past 20 years, just moved out to the suburbs about a year and a half ago. And it was very difficult in D.C., where literally thousands of providers were at my doorstep. I couldn't find a new provider, or if I could, it would take months for me to get to an appointment. I moved 10 miles away, 20-minute drive, 25-minute drive. And now I have a lot more providers that I'm able to get to easily and not wait 2 to 3 months for. Another issue is like biases in care. So we know that providers, either wittingly or unwittingly, have biases against patients based on their race or gender or socioeconomic background. And that sometimes causes them not to provide the best care. So there are a lot of different issues that patients face when it comes to access. And the last would be, I guess, like just access to information. In healthcare, unfortunately, there are data silos, and a lot of that is to protect patients. But that means that patients don't have access to their information. And it also means that providers may not have access to complete information for a patient. And some of these things CX can help with, and some others we need to definitely depend on our wonderful technology partners to address.
I was going to say that. I mean, that's a lot of challenges that many of them are out of your control.
Yes.
And yet, if everybody in the organization really owned the patient experience, a lot can happen.
Mm-hmm.
Do you see that people are owning it or pointing fingers?
I think everyone owns their part of it, but that doesn't work, right? You need kind of interconnectivity within an organization. So what we always say is if a patient or a provider is interacting with Pfizer, they don't care if there's a difference between a medical SME or one of our medical affairs colleagues or a sales colleague or the call center. All they know is I'm talking to Pfizer. Pfizer should know what's going on with me. I'm their customer. How is Pfizer servicing me? So you can't treat yourself differently within an organization just because you roll up to a different executive leadership team member, right? That's where that kind of seamless and consistent experience comes into play.
Mm-hmm. So going back to access,
Mm-hmm.
and that was heartbreaking when you said that some people don't get access because of bias. Oh, that hurts, but yet reality.
It is reality.
So what do you do about that? How do you conquer that in, a huge space, even if it's just America?
Mm-hmm.
What do you do? Is it training? Is it share? Like, how do you conquer that?
Yeah, I training is one way, certainly, and that's a start. I think one thing is to start by understanding what the source of the bias is, like what the root cause of the bias, where it comes from. And then based on that, developing training or coaching to address that bias with healthcare workers. We all have biases. You can't get around it. So it's really about addressing them. I think also we have a behavioral science lab in our CX organization. And I think leveraging behavioral science methodologies to figure out how to change behaviors going forward also could make a huge difference. And that's how we would approach it. So research first, understanding that provider, and then applying insights in leveraging behavioral science.
Dig a little bit deeper on that with me.
Mm-hmm.
Behavioral science and the connection to customer experience. I mean, I bet a lot of people in companies are not thinking about behavioral science. Is that an investment? Is that a cost? And why does that matter?
So from our perspective, it definitely is a meaningful investment. It does cost. Like, we don't have behavioral scientists on staff. So in order to deliver that service to our organization, we partner with external agencies and external behavioral science to deliver it. Where we've seen it work well is looking at, like, in vaccine avoidance, how we could advise the general public that when they needed to seek either antiviral or if they needed to consider getting vaccinated. So you introduce different experiments to the general public and see what works best in changing their behavior. So you present them with information, present them with different options and see what options work best as far as changing behaviors.
Mm-hmm. And I imagine it's almost perception management,
It
right?
is perception management, yes,
And
definitely.
digging into the mindsets, which is, in a way, sales 101, marketing 101, CX 101, really what makes us move and make decisions.
Yeah, what makes us move and make decisions, and also what would change that behavior, like what would actually move the needle in changing that behavior at scale.
Yeah, change management. What does that mean? Many companies have change management teams. What does change management mean in your industry?
So yeah, we are heavy in change management at Pfizer. We have several teams, depending on the part of the organization that does it. For CX, change management is essential because a lot of colleagues don't really understand CX. So no one's going to argue
Yeah,
that customer experience is important, right?
yeah.
No one is going to say, no, we don't want to focus on what our customers need, but they don't know how to apply that at every level, right? And in every role. So what's important for us to explain what customer experience is in layman's term, not be so theoretical, but really provide colleagues with some language that they can wrap their heads around. And also, once we provide that language, provide training. We do real-time and on-demand training to say, this is what CX is, this is what our experience principles are, and this is how you can apply it in your day-to-day jobs, because everyone has a role in customer experience. At least that's my belief.
Oh, I second that
Mhm.
absolutely. How do you measure that you're doing customer experience right, patient experience right? What comes to mind to know and gauge?
The easiest metric is customer satisfaction, right, or patient satisfaction. So we embed measurement in our new experiences that we launch, where we ask customers, on a scale of 1 to 10 or 1 to 7, how they feel about an experience and if they're satisfied or not. And we actually have specific customer satisfaction targets for new experiences. So our CEO wants 80% of customers to be satisfied with experiences, which is a pretty high bar, where you're looking at customers being very satisfied or satisfied with an experience. We also leverage a net promoter score. So whether or not a customer we would be willing to refer or recommend us based on the experience that they had with our organization.
Mm. So you talked about the need for behavioral science to understand our minds. You talked about an organization and a culture focused on the patient experience. You talked about some measurements to know that you're doing it right. For people listening that are in the healthcare industry, what are suggestions you have that you want listeners to do to help in terms of human care and customer experience? Because we're all patients.
Mhm.
Not all of us work in the industry, but we're all patients and we're all affected by the work you're doing. So,
Mhm.
what do you want listeners to understand that's happening both from the employer side, but then also you as a patient, for others who are in the healthcare industry? What do you want them to know? What's easy to do to make it better?
First, and I think I mentioned this earlier, is really to deeply understand whatever customer you're servicing, right? So we use the term patient, but there are all sorts of different types of patients, and each of those patients or each group of patients has different needs. So an oncology patient's needs are very different than an immunology patient's needs or someone who has a rare disease. So it's really critical that we don't overgeneralize and we look at what the needs of those patient populations are and take the time to do that. I think a lot of times organizations want to jump to solutioning because, of course, we know better than what our customers do, right? And you have to take that time and be deliberate about understanding the motivations and needs of the specific patients you're servicing. And once you do that, it's really about understanding the journey, what their current journey is, and what opportunities there are in the journey. And based on that current journey, looking at where there are gaps in services or solutions for those patients or customers, and developing a strategy to address those gaps and challenges and pain points that they have. We call that service blueprinting. I think most CX organizations do that. So it's not just about the journey, but kind of if you look at what gaps there are, challenges, what people, process, and technology can support closing those gaps. And then once we do that, we typically bring an experience to life, and that's through our design team. So we develop prototypes or concepts, and we test those out with our customers. So we circle back. So we start with the customer. We do our work in strategy and design, and then we validate the experiences that we want to provide to the customer. So we find a sample set of customers, and we ensure that what we've come up with makes sense for them and that they have that customer satisfaction. So we reach that customer satisfaction target in the experience prior to launching it. And even once you launch that experience, there's a need to iterate on the experience. So we continue to validate the experience. So get that voice of customer feedback, do that measurement and launched experiences so that we can iterate on the experience and make it better for our customers.
So that's gold. And anybody listening, I want you to know that this applies to every industry. So to recap is understanding your customer, create a persona. Who is that buyer? What are their needs, right? So there's lots of templates out on the web of persona development. Even on my own website, I have it. And then you create the journey for that persona. Usually there's personas. And then,
yeah.
Right? And then there is the development, reiterate, feedback, fix the gaps, close the loop. And that's a very high level, simplistic way to design an experience. So thank you for articulating that, because I really think it is applicable to whether you're selling phones or medication or service.
Yeah, definitely. I think one thing I love about CX is that you could lift and shift to a different organization, different industry. Of course, you have to understand, again, what problems you're trying to solve for. But it's a methodology that can be used anywhere and can be effective anywhere, and really, demonstrate impact and value in any organization.
Absolutely. Now, what's your prediction, if you had a crystal ball, where is the industry going, especially with AI and tech enabling or maybe hindering? I don't know. What's your crystal ball?
So I think if AI is used responsibly and we continue to leverage humans in the use of AI in the short term, that it can definitely positively impact healthcare in other industries as well. I mean, I'm using AI every day. I'm sure many of us are, whether we know it or not. And it's not the enemy to me. It definitely has already produced so many productivity gains for our organization. We use AI to do research synthesis, develop personas, develop first draft journey maps, and to develop storyboards. So we're using it in that way, and we're iterating and trying to figure out how much more we can use it. I think what scares me is that sometimes you hear colleagues say, "All right, let's use AI. Let's throw an avatar in there," and I'm like, why? Are we sure that's what needs to happen here? So I think you have to, again, use it responsibly. So figure out what the best use of AI is in any experience. And if you're going to use an AI-enabled chatbot, then make sure there is a button that allows users to get to a human if they need to. And if you're going to introduce AI and that AI is providing answers to healthcare problems, make sure that it's well tested and validated with users prior to launching it. And I think that everyone's so anxious to get AI out the door that sometimes that work isn't being done.
Oh, I agree. Any other predictor of what's to come?
I have no idea. I just think about like a couple years ago, we were so excited about AR, VR, and now no one's, talking about it as much. So I think, once we get over the AI hype and there's some consistent use cases across industry, then we'll see kind of what's next. I do think that it will create all sorts of changes in our world, which is super high level, but absolutely what I believe.
Mm. Well, rapid fire questions as we're at the end here. What is the best leadership advice you've received or given?
So I don't know if it's leadership advice, but my grandmother used to say, there are enough ways in this world for everyone to have their own. And I was like, at 6, what does that mean? And as a leader, to me, it's about sitting back and listening and allowing for the fact that your way may not be the way, the best way, or even if your way is the best way, it may not be the way the project or the experience goes, because everyone has a say. And being open to that is super important and critical to us from a CX perspective.
Yeah, and that's where culture comes in, making it safe to have a voice. But that's another episode. And last is, what's the one takeaway you want people to remember?
I would say CX cannot be used everywhere, but where it works really well is, again, where you need to understand the motivation and needs of customers and be able to address them and personalize an experience for the customers, and where you also can demonstrate ROI for those customers.
Very well said. Well, thank you for sharing your wisdom and for doing so much right and being part of the CX movement, and glad to have you here. So thank you.
Thank you.